Hey there, it's Dr. Alan Bauman from Bauman Medical Hair Transplant and Hair Loss Treatment Center. And testosterone therapy in men is getting so popular because it can improve sex drive, reduce erectile dysfunction, it's great for muscle mass and stamina and strength and brain function, but it definitely can have some risks when it comes to your hair. We're going to talk about why and what we can do about it, so stay tuned. Hormone replacement therapy in men is increasingly popular. Testosterone replacement has so many great benefits, but it can definitely affect your hair, and here's why. So androgenetic alopecia, or male pattern hair loss, is the sensitivity to dihydrotestosterone. That's an androgen, a metabolite of testosterone in your body. So guys with male pattern hair loss are not going to have some increased massive amount of testosterone or DHT, but what they inherit is a sensitivity to it. And that's what causes your follicles to miniaturize. Starts at your hairline, continues in the crown, and could end up in total baldness. But there's a lot we can do to stop that progression. Even normal male pattern hair loss can be stopped with medications, topical oral treatments, laser light therapy, PRP, platelet-rich plasma, and of course, other types of therapies like nutritionals and nutraceuticals can also help the situation. If you're on testosterone, however, that's going to increase the level of DHT in your body. And DHT is that bad trigger. So what can we do about it? We can do those medical therapies, but if the follicles are dead and gone, then we're going to have to do some degree of transplantation. So if you're a guy and you're thinking about testosterone therapy, or maybe you've been on testosterone therapy and you know you have a risk of hair loss in the family, mom's side or dad's side, the time to start treating your hair loss is right now. And there's a lot we can do to prevent those hair loss side effects from testosterone. What we want to do is we want to make the hair follicles more resilient so that they're less affected by the dihydrotestosterone. We maybe want to think about what's the appropriate dose of testosterone that you're on. So whether you're doing a patch or a pellet or an injection or a cream, we may want to titrate that dose down so you get good effects from your testosterone, but no hair loss effects if we can. And we want to track your hair over time. So we can measure your hair here in the office and determine what your hair loss risk is, and we can track your hair growth or hair loss as we go along into the future and track the response to either your testosterone therapy, which could be a risk factor for the hair loss, or from the treatments that are designed to protect and enhance your hair growth. If you think you might be at risk for hair loss due to testosterone replacement therapy, schedule your consultation with me today and let's have a conversation. Click on the link below to get started.